After removing it from the ultrasonic cleaner, rinse the basket of instruments, keeping in mind that these items are still contaminated. Dump them all on a disposable paper towel to pat dry in preparation for sterilization. If any item becomes trapped in the basket or falls into the solution, use non-sterile forceps to remove or retrieve it. Never reach in with bare hands, even if gloved. Loose dental instruments are packaged for sterilization according to use, like an examination setup or an amalgam setup, and some items like the anesthetic syringe are packaged individually. Sterilization sleeves are available with one side clear, which allows you to see its contents. Paper sterilization bags require that you write its contents on them. Most packaging has sterilization indicators printed on it. Others require special masking tape with indicator bands. Remember, though, these markers don't prove that the contents are sterile, just that they were exposed to a temperature high enough to change the indicator's color. Biological monitoring procedures are used to prove that the sterilization process works. Dental air-driven handpieces have special needs when being sterilized to protect them from damage. As you'll see, the high-speed handpiece should be purged with air and water for 30 seconds or so before leaving the treatment room. Next, with a spray can of lubricant used only for dirty handpieces, the handpiece is sprayed within, wiped clean, and then packaged for the autoclave. Remember to use a different, clean lubricant after removing the handpiece from its sterile package and just before attaching it to its air hose. A drop of oil is placed in the slow-speed motor and on the gear of each slow-speed attachment after every autoclave procedure. Sterilization of the instruments does two things. First, it kills all forms of life on the instruments, within the packaging and inside the sterilization chamber. And second, it renders harmless all residual spores that may seed an infection later. Sterilization is accomplished by one of two methods, either dry heat or steam autoclave. While liquid cold sterilization was once used, it's no longer recommended since its effectiveness cannot be properly monitored. Dry heat sterilization is limited to items that can tolerate up to 340 degrees Fahrenheit, and this is usually only metals, although some nylon items can stand the temperature. Most dental offices don't use dry heat, though, in spite of its simplicity, but as a sterilization system, it is simple and effective, albeit somewhat slow. Using a thermometer and a timer to monitor the process, heat the properly prepared, foil-wrapped items to 340 degrees for 1 hour or 320 degrees for 2 hours. Increase the time if the packaging or the loads are large. It's preferable to preheat the sterilizer to the operating temperature before you insert the items. Remember to use the indicator tape to later remind you that the package has been through the sterilization process. Store the items properly after they are cooled. If certain items were not wrapped for the dry heat process, be sure to transfer them to clean storage containers using sterile forceps. The state-of-the-art method of sterilization in the dental office, though, is the steam autoclave. It uses extremely high pressure, high heat, and steam to kill all forms of life within its chamber. Absolutely nothing survives. Some machines automatically monitor the process using computer chips, and others require your intervention. It's important to always remember that sterility is only guaranteed if the instruments are exposed to the 250 degree and 15 pound per square inch conditions for at least 20 minutes, and even longer if the load is large. Prepare the instruments as described before, except think about steam reaching them. Foil wrapping prevents this and should only be used for small items, and then only after placing several vent holes for the steam to reach within. remember to follow the manufacturer's instructions in calibrating and operating the machine. For a manual autoclave, the process follows this flow. First, prepare the instruments as described, rinsing them, ultrasonically cleaning them, packaging them. Verify that the steam autoclave has sufficient clean water and power. Place the packaged items loosely on the autoclave's trays in a way that would allow steam to surround them all. Fill the chamber with water, following the manufacturer's instructions. Adjust the thermostat to 250 degrees if required. Start the heat process. Only after full pressure and temperature are reached should you start the autoclave's timer. Depending on the machine, it may sound a bell or shut itself off even when the cycle is complete. Then you may vent the autoclave. Slowly open the door only after the pressure gauge reaches 0, and using a clean oven mitten, remove the trays and set them aside to dry and cool off. Package any unwrapped instruments using sterile forceps, not your bare hands. A new and more rapid autoclave, like this Statum unit, is available that can render unwrapped instruments sterile in just a few minutes, using extremely high internal temperature and pressure. Their compactness, though, restricts usage to smaller loads and instruments. At least once a week, and even more often in surgical offices, include a biological spore test in a sterilizer's load. These have live bacteria that fail to develop in cultures afterward, proving the autoclave's effectiveness. In-office kits and tests that are handled independently are equally effective. Since we really can't assign an expiration date to sterile packages, dental instruments should be rotated. Store them so that older packages are used first. You may want to re-sterilize items that have been stored unused for a year or so. The treatment area is rendered safe for patient care in two ways, through chemical disinfection and by covering. This double ensures protection for the patient, and if you do both, you should emphasize to them that you do both. In order to assume that the surfaces are disinfected, 3 conditions must be met. The surface must be clean of debris so that the disinfectant can make contact. The disinfecting solution must be fresh and viable. And the solution must make contact with the surface long enough to kill dangerous residual spores. Every chemical disinfectant is different. It's important to use one that is EPA certified. Follow the instructions on mixing and activating each agent, and mark the spray bottle with an expiration date. Most are effective only for a set time span. And store it in a cool place. This limits heat degradation of the chemicals. Watch as the dental assistant uses this process to make this treatment area safe and ready for the next patient. Notice that the process requires that she do the following things. Of course, wear protective equipment: gown, rubber gloves, and eyewear. Next, run and purge the dental handpiece for 30 seconds. Then, remove the items to be sterilized to the sterilization area. Flush the vacuum lines for 30 seconds or so with water. Remove all sharps to the sharps container. Discard all disposables. Once these are all done, spray all the surfaces with disinfectant and allow it to soak for 2 to 10 minutes as recommended by the manufacturer. Then wipe off the excess disinfectant. Next, remove your soiled utility gloves and place clean disposable covers throughout the treatment area. Lubricate the clean, sterile handpieces and attach the handpieces to their air hoses. Notice that the counters and trays may be covered with paper made for that purpose. However, never use stacks of paper, simply removing the soiled top one. Light handles can be disinfected, covered, or both, and some handles are removable and autoclavable, especially those used in critical surgery procedures. Chairs should also be disinfected and draped. Many dental offices find that inexpensive and plentiful plastic dry cleaner bags work great. Headrests may be simply included under the chair cover, or they may be shielded with a small cover sleeve of their own. Again, by using disinfectants and barrier covers, you double ensure that every treatment area is safe for every single patient. Keep in mind that the patient's chart should remain out of the treatment area to avoid becoming contaminated. Any entries should be done using a clean pen and hand. Also, the dark room should be treated as a treatment area as well. Proper developing techniques, which are described in the film on radiography, help to keep it clean and safe as well. And finally, the laboratory is especially susceptible to contamination, so be sure to review the film on prosthodontics for the lab's special needs. Proper infection control uses a concept called universal precautions. It simply means that you assume every patient is infectious for even the most aggressive of diseases. Now naturally you don't tell the patients that, but you do everything within your power to make sure that nothing carried by one patient is shared with another or with yourself. Whenever in doubt, review and relearn. If you'll remember to do for every patient what you would do for your own self in instrument and treatment area preparation, you can never go wrong. This program only introduces you to the ideas of professionalism and infection control. There is never ever a time to sit back and just take it easy. New opportunities and challenges come up. You must stay abreast of how they should be managed. The availability of training materials and programs is tremendous, so stay informed and stay safe.